From 2001 through 2005, 56% of HIV/AIDS cases were reported from the South, of which 54% were among African Americans. In addition, African American students reported many behaviors that promote HIV transmission, including multiple partners, unprotected sex, and using drugs or alcohol during sex. Yet despite these behaviors, many African American college students believe they are at low risk for HIV infection. Clearly, there is a desperate need for new strategies of HIV/AIDS prevention and interventions to reach African American college students. In 2009, the Arkansas Minority Health Commission funded JCCSI to implement the SISTA Program, which is an intervention developed by the Diffusion of Effective Behavioral Interventions Project, DEBI, and endorsed by the CDC as a science-based, effective intervention that specifically targets sexually active African American women. It first was implemented in an African American community in San Francisco in 1993 with the following results. Participants in the intervention demonstrated increased consistent condom use, sexual behavior self-control, sexual communication, and sexual assertiveness skills. And the partners of participants in the social skills intervention were more likely to adopt and support consistent condom use. Because the target population includes female college students attending Arkansas Baptist College, Philander Smith College, and the University of Arkansas at Pine Bluff, JCCSI changed the name to Sisters to duplicate a sorority-type theme for the trainings.
It is an HIV prevention and social skills intervention program aimed at increasing condom use and reducing sexual risk amongst African American women.
And is composed of a group of 12 students who meet a total of 5 times for 2 hours each.
I attend UAPB. I'm part of the second session. And one thing, my major is criminal justice. And one thing that I got out the program was it's all right to go get tested. You don't have to be ashamed.
Sessions are gender and culturally relevant and include behavioral skills practice, group discussions, lectures, a prevention video, take-home exercises, and role-playing.
Okay, but look, she could have slept with 6 dudes. Them 6 dudes could have slept with 10 girls. Look at all this stuff you could have had. You never know, Terrell. It been 4 weeks. What do you mean? Terrell, come on. You look. I went to. You don't really want to wear no rug. Yes, I do. Look, I got some new kind. I got some vibrating kind. I don't care if they. Look, it's glue in the door. I got a new trick for them. We can use that stuff for real. So look, how about we go take this AIDS test together? Then we come home. We gonna try my new trick or something. You know what I'm saying? Okay. All right, come on. All right, good job.
By participating, students received $65 in gift cards, $30 in gas cards, a Sisters t-shirt, a Sisters jacket, and dinner at each session.
I love the program a lot. It taught me a whole lot.
After completing the sessions, students evaluate the trainings. Measures include knowledge of HIV/STD transmission, knowledge of risk reduction strategies, perception of personal risk, assertiveness, communication, and negotiation skills, attitudes of consistent condom use, and intentions to reduce high-risk sexual behaviors.
Through the program, I learned to be more responsible of myself and to take care of myself, because HIV is real, and I learned so much about HIV that I could even share with my friends, both here and also back at home in Kenya.
Results have shown the following significant changes. The percentage of participants who report insisting on condoms, even if the main partner uses other birth control methods, has significantly increased from 78.6% at pre-test to 97.6% at post-test.
One of the other things I learned is how to use a condom. Back in my country, I'd never seen a condom. I didn't know how to use it or what people were talking. But I was so mesmerized when we went to the Sisters Program and everybody was talking about it and it was not wrong.
And the percentage of participants who believe that female condoms are effective in preventing HIV infection has significantly increased from 65.7% at pre-test to 87.8% at post-test.
And the thing I've learned was how to use a female condom. And just because he said he got tested, you need to see papers.
Good job.
Right.
Good job.
After the sister sessions were completed and all students graduated, they became sisters and held a graduation program where they performed skits and received their sister's jacket. Special guest Philander Brassfield, contestant on America's Next Top Model, spoke at the graduation and congratulated the sisters on their achievement.
We are getting the disease faster at a higher rate than anybody else. And I just want to commend you all for taking time out of your schedule, for actually taking a stand.
The Sisters Program would like to thank Jefferson Comprehensive Care System Incorporated, the Arkansas Minority Health Commission, as well as the SISTA Program.
We hope that this program can continue because, as you can see, there's so much more work to be done.
After graduation, the sisters began to work on the billboard campaign that would promote HIV testing. These professional billboards were located throughout Little Rock and Pine Bluff, displaying the message, "Sisters talk, sisters listen, sisters get tested." In addition, routine HIV testing was implemented each month on their campus. During each testing day, 30 students were targeted to get tested and received an HIV testing shirt. All those with a shirt received free entry to a party at the end of spring break. 300 students were tested and received results.